sure, now it shows 25. What's normal glucose?
Forgot.
70 to 120
70 to 120. So he's
milligrams per deciliter.
So he's
Hypoglycemia.
So I give him some candy. Or I
He's
give him
passed out. You don't
So-
give anybody that has altered mental status or maybe the inability to swallow anything by mouth.
So I put
No
him on
fluids,
IV
no
dextrose.
food. Okay?
Dextrose
So
IV.
you have somebody start an IV on him, and you give him D50W,
And
which is
glucagon.
half water, and you give him D50W. He can't swallow. Glucagon is in the mouth. He can't
No,
swallow.
glucagon.
D50W,
Okay.
or glucose is actually in the mouth. So it comes,
Glucagon isn't in the IV?
right, but it's a little tube, and it's like toothpick. You squeeze it in the mouth if they're able to swallow. If they're not, you don't give anything in the mouth.
So you give him half D50?
You give them the whole tube. It's half sugar and half water. It's D50W, 25 grams of sugar. And within a minute, he's gonna be waking up. Okay? Now you take his sugar again. Now it's 210.
No, you gotta give him.
No, you don't give him anything. It's high. It's okay for now. All right? Now you say, hey man, what happened? He's, oh my God, I went out drinking last night. I was supposed to, take my medications and I didn't, and I just forgot. And maybe I just took too much. I don't know if I took too much insulin or something. I don't know what happened. All right. So his friend found him, laying at home, couldn't wake him up, threw him in the car, and brought him to the hospital. All right. So you just saved that patient's life. That's the miracle drug. They think you're God. You're like, whoa, wait a second, he's perfectly fine. So now you gotta monitor him. You're in the hospital. You gotta monitor him, make sure he's okay. Probably have him eat something. If it's something that happens at home, you make sure that somebody's there with him. You recommend they go to the hospital or take him to the hospital yourself if you're fire rescue. You gotta check glucose right away. Any altered mental status, check glucose. Could be many different things: heart attack, stroke, environmental, glucose too low. Okay?
So what would happen if you found, like, if you got the ambulance call and you were on the ambulance and you're on your way over there, and you found a guy like that, and on your way to the hospital you treated him and he's back to normal, you still admit him to the hospital?
Yeah. Take them to the hospital. They probably won't want to go because they know what's wrong. Epileptics and diabetics don't want to end up in the ER. They know what's wrong. Epileptics probably didn't take their medication, and diabetics probably messed up on their medication. Either took too much insulin, which knocked the sugar down too low, or didn't eat, or drank too much, or something, They know what's wrong. If you're pre-hospital fire rescue and, you give them D50 and they're conscious, alert, and oriented, in other words, they know where they are, who they are, the year, this and that. There's a family member there, you never leave them alone. There's a family member there. Say, you want to go to the hospital? No, oh my God, no, please don't. They don't want to go to the hospital, they want to end up in the ER. So, okay, ma'am, can you make him a sandwich? Here, eat the sandwich before we leave, okay? And then you have him sign, recommended the patient, he go to the hospital, refused to go, recommended he follow up with his doctor.
Let me know.
Let's see now. Okay, patient comes in again, another 45-year-old male, cool, pale, diaphoretic, weak, arms are heavy. So my arms just feel so heavy, both arms. I don't know what it is.
Okay. I ask him, take his vital signs. I ask him what's going on.
Establish responsiveness, limitation, mental status. Can you tell me what happened? What's going on? I don't know. I was sitting at home and just started to feel anxious, and my arms got real heavy, and then I just started sweating, and the wife brought me to the hospital.
Ask him if he's on any medication.
Okay, that's fine. In the meantime, what are you doing? What's the worst thing that can happen to this patient that just came in?
He dies.
That he dies. What are things that can make him die?
Heart attack. So I put him on an EKG.
You got, hey, you bring me to 12 lead. To the 12 lead. Sir, are you having any chest pain? You gotta be aggressive. You can't just say, okay, so what medications are you taking? Okay? You gotta be aggressive with these. Any male over 35 or postmenopausal women, have higher chances of having heart attacks. Okay? Anybody can have a heart attack, but within 1,000 patients that have heart attacks, 950 are going to be in a certain range of, weight, age, previous history, that kind of stuff. Okay? A 6-month-old can have a heart attack. A newborn anybody can have a heart attack. But normally, this is what you would look for. So, but always be suspicious that, hey, maybe this is the one that's outside the box. The outlier. Always think outside the box. Always think one step ahead. Always keep a high index of suspicion. Okay? Somebody says they were playing a baseball game and they were in a non-deck circle and the guy hit a foul ball and it hit him in the left or right upper quadrant. What are you going to suspect? Possibly fractured ribs. You check for ribs. You check lung cells. Make sure they don't have any kind of pneumothorax. Okay, make sure they have good equal chest rise. They're not having difficulty breathing. Collapsed lung. Make sure that pneumothorax, if they do have a collapsed lung, doesn't turn into a tension pneumothorax. Okay, so all that air that's collecting in there, because remember the lung has a hole in it because the baseball hit the rib, popped the lung. Correct? So now every time they breathe, air goes in. When they exhale, it comes out of the good lung, but in this bad lung, it stays in the cavity. So now another breath. More air in the cavity, more air in the cavity, more.
So now it's going into the hole that was punctured?
Yeah, into the chest, around where the lung sits.
They're gonna have a barrel chest.
Don't worry about the barrel chest. What they're gonna have is a tension pneumothorax. So all that air starts collecting and starts pushing everything that's in the mediastinum, which is the heart and the great vessels. The mediastinum is the area between the lungs that contains the heart and the great vessels. Starts pushing on that. So now you have the heart, instead of doing this, all that pressure is doing this. So now stroke volume, which is the amount of blood that the heart sends out to distribute to the entire body, is diminished. Normal adult, it's about 70 milliliters. 80 beats per minute, 5,600 milliliters, or 5.6 liters. It can be increased in athletes through the Frank Starling effect, the rubber band effect, which we'll get into later. So now only 40 milliliters of blood are going out times 100 beats per minute because they're anxious and the blood pressure's dropping a little bit, so the heart kicks in a little faster. It's still 4 liters, 4,000 milliliters. They've dropped 1.6 liters, right? So now they start getting a little dizzy and their mentation starts to go because the brain isn't being perfused the way it should be. So if that continues, eventually you're going to see jugular vein distension and you're going to see because all that pressure builds up there in the jugular veins. Okay, and you're going to see a tracheal deviation to the unaffected side. Okay, but these are late signs. Don't wait till it gets to that. Listen to the lung sounds. Hey, a little bit diminished on the right side. You know what? Breathe on the left side again. Hey, do me a favor. Listen to the lung sounds. Confirm it.
You listen to the back or the front?
You listen everywhere you can. You're going to see that they're a little bit diminished. You're going to have to pop that chest. Okay, what does that mean? You're going to have to stick a needle in there, some commercially available cook decompression kit or whatever it is they're using nowadays. Mid-clavicular, second intercostal space. Go in there, what's going to happen? Air's coming out. If there's blood involved also, it's going to be a hemopneumothorax. But air's going to hiss out. You'll probably see some videos online. And now everything's going to go back to normal. Okay? So once stroke volume is affected, then perfusion is affected. What is perfusion? Oxygenated blood getting sent to every cell in your body. Okay? So cardiac output is affected. So when cardiac output is affected, you got to figure out why. Is it because of a heart attack or is it because of the trauma of the rib?
It's like a puzzle.
It's a puzzle.
You have to figure out this is getting affected by what.
If I tell you, I'm going to describe an animal to you. It could be any animal. I'm going to say, hey, listen, this animal, they live close to lakes and canals. They have wings. They fly, but they don't fly real good. They have webbed feet and they have, a beak. They go quack, quack. You're going to say, it's a duck. Okay, so when I start telling you things, because of your knowledge of medicine and pathophysiology and diseases and stuff, you're gonna say, you know what? It's gotta be this. You know, if you watch some of the shows that we watch, The Resident, for example, sometimes they're like, oh my God, you know, your mom and I are trying to guess it here. Sometimes I guess it, sometimes she does. You know, sometimes we don't. Sometimes they say things that I don't understand. I gotta look it up. You know, when he's rare, oh, he's got this rare disease. You know, you understand? So you have to. Your job is to rule out something that's gonna kill your patient. Okay, so you have a 30-year-old male, a 20-year-old male was at a gym, started to have chest pain. His girlfriend brings him to the hospital. You're the nurse. He's having chest pain. First thing you have to rule out is that he's having a heart attack. So put him in a 12 lead and draw some labs. Okay, you want to look at the troponin levels. The heart,
That's what the heart releases
when it's in distress, it releases enzymes. One of them that they check is troponin. Okay, if the troponin is within normal limits, no big deal. But last thing you want to tell that guy, he's 20 years old. Remember, most out of 1,000, 950 are this. Well, 5 might be 20 years old or younger. You always have to rule out something that's going to kill him. So the last thing you want to tell that guy is, what were you doing? Oh, I was doing chest and flies and this and that and really working on my chest. You know what, man? Just take some Advil, you know, anti-inflammatory, non-steroidal anti-inflammatory drug. It'll get rid of your pain. It'll help with the inflammation. It's probably nothing. It's probably muscular. No. That's the last thing you tell them after everything else that can kill them is ruled out. Okay? Hey, we don't think you're having a heart attack, but we got to check it out and make sure. Because the last thing we want is for you to have a heart attack and we don't catch it. So we're going to examine you real good and check you out and make sure you're not having a heart attack. So you want to rule out AMI, acute myocardial infarction.
I want to watch a video on like pneumothorax.